All right, so we're going to talk about position and latch, and normally we're doing this, of course, in a skills rotation where we might be in a small group, and I'm actually having y'all do this, and I would give you some extra babies and boobs, and we'd have a little fun with this. But you have to just look at me. Sorry. So anyway, so let's first look at some different positions. I'm sure many of you have some favorite ones. Often when I ask this question, what's your favorite position to teach a new mom? Many of you will say the football hold. So let's talk about why the football hold is so popular and such a good beginner position. So one aspect of the football hold is that we have good head control. We have our hand at the base of baby's head, not on the crown, where I'm going to be breaking baby's alignment. So we've got good head support, and we have legs go under baby's arm. If mom, of course, is in a hospital bed, we want to make sure she's got pillows behind her, so maybe legs can kind of go up the back of the bed and baby's not pushing and ejecting himself away from mom. But the other nice feature about the football hold is I'm going to support my breast, and I'm going to kind of make that C hold. And what's really nice, that just kind of happens naturally, step in a little bit closer so you can see. We're zooming in reverse, if you will. So what's nice about this, it just happens naturally, is as you see, how are my fingers in relation to baby's lips? Are they perpendicular or parallel? And we want them parallel. So think about that sandwich analogy. When you guys go eat lunch after this session and you're eating a hamburger or a sandwich or whatever, you're kind of sandwiching that down so you can get your mouth around it, and my fingers are parallel to my lips. I'm not sandwiching this way. So that's what we want to do to make it easier for the baby to latch on, especially when they're first learning. So that happens kind of naturally and easily in the football hold. The other key thing about this is mom has a good view of baby's face and eyes, and which is in closer for the baby when they're latched in this position. Is the baby's chin in closer or the baby's nose? It kind of looks like the chin, right? I've got plenty of room for the baby's nose for the airway, so we're not obstructing the airway. Now I'm going to step back a bit and demonstrate another key aspect of a good latch. Whatever position we hold baby in, there's something really important about having the chin in closer. So if you visualize the inside of baby's mouth in this position, which way is the nipple likely to be pointing when that chin is in closer? Would you say the nipple's more likely to be pointing up? Yes. Now, if the baby is latched on and mom's having to pull the breast tissue away because the nose is in so close that the nose is kind of buried, and you see the chin a lot further away, now which way is the nipple likely to be pointing? It's pointing down, right? Why is that important? Many of you kind of know this already. We need that nipple far back in baby's mouth to stimulate the sucking reflex. So once again, babies breastfeed, they're not nipple feeding. They're opening their mouth really wide. Look at the angle of my hand. So I want baby's jaw to look like that, baby's mouth. So you see a wide angle to baby's mouth so they can get a good mouthful of breast tissue and a deep latch. So that nipple is going to go way back into the mouth. And we want that nipple pointing up towards the roof of the mouth, so it will stimulate that suckling reflex. So that all kind of more easily, naturally falls into place in the football hold. This is also nice, of course, for moms that have had a cesarean section or whatever. So just can be very comfortable, but maybe pillows underneath for baby. So anyway, so those are some key aspects of that. Now we're going to also switch over to cross cradle. This is probably another one that many of you are familiar with. And I can just slide baby across. And once again, we want to make sure we keep baby in good alignment. So we don't want baby in the football hold where they get kind of jackknifed or really scrunched up. We don't want baby so far away from mom that, they're hyperextended or they're, breaking this alignment. Their chin isn't too close to their chest. So we want a good straight line for baby's little body. And so here we are in the cross cradle hold, and that also happens more easily because I'm holding the baby with this arm. And I can't have baby too far away from the body. I'm going to have baby up really close because I've got the arm right there. So baby stays in good alignment. Now, I'm going to move in a little bit closer here because as we now get my hand to support the breast, my breast that floats in thin air, right? Anyway, as I bring my hand in and I'm making that C hold, got my little elbow sticking out here. And now when I bring baby in to latch, how are my fingers in relation to baby's lips? Now they're more likely to be perpendicular, right? So I've got to make a little adjustment here. And this is kind of awkward too. So really, if I swing that elbow in and kind of rotate or pivot my hand, now I'm making a U instead of a C, right? So I'm making a U hold, and I bring baby in. Now my fingers are parallel. I've got a good little breast sandwich for baby to get his or her mouth around. And now with a newborn, I may need to just kind of keep my hand here during the feeding, especially in the first several feedings, first few days, to make sure baby stays on good, that they keep a deep latch. Later on, as baby's getting the hang of things, I can let go and switch arms. And now I've actually moved into that advanced cradle hold, which is a difficult one to start off with for a new baby. So the other thing is I moved back here with this cross cradle hold. If I've really got baby hugging mom in good alignment, can you see baby's nose? I have plenty of room for baby's airway, so I've got my chin in closer too, right? It's really hard in this position to dive bomb into the breast. So what we see with moms who are starting out, and a lot of the pictures they see of breastfeeding moms, of course, is that classic cradle hold. This is how I'm supposed to hold my baby. But how many of you have walked into the room and baby's hanging on for dear life? We've got nose digging in, mom's pulling on the breast, and she's still got her good pregnancy belly, so we're kind of resting baby on that, and things just aren't working right. And it's much easier to break the alignment, have the nose in a lot closer in that cradle hold. So now one more position to make sure that y'all are familiar with. I'm going to move this chair in a bit. Not the greatest chair for demoing this, but how flexible are we these days with COVID now? But this is what we call the reclined or laid back breastfeeding. Make sure you can see. So I'm not completely horizontal and I'm not completely sitting upright. I'm at my back's at about a 45-degree angle. And many of you, if you work in labor delivery, this is kind of the position mom may be in for those first few feedings right after delivery. And so this can be a comfortable position to use later as well, not just in the first couple of hours. So in this position, I can still have some good head control. I can kind of let baby find their way to the breast, and I'm not bearing the weight of baby's body in my arms. Now, if I've had a C-section, this might not, work so great, or we might want to angle baby a little bit. But this is also another one where baby can kind of make their way. Of course, we want to always make sure that we have a safe environment. So do we need the rails of the bed up, or do we need a pillow over here? So mom's well supported as well. But in this position then, I'm just kind of lightly supporting the breast and baby, and of course the chin is going to come in first. It's really hard in this position, once again, to get that nose in closer. So we get good latch that way as well. So that's called reclined or laid back breastfeeding. So I'm going to stand back up, move my chair back out of the way, and let's see. So let's talk about maybe sometimes when things aren't working, I'm sure some of you have stories. One of the other, we've talked about fingers parallel to lips, wide open mouth, good deep latch, good mouthful of breast. One complication that can hinder that, of course, is baby's tongue. So if baby has any restrictions of movement of the tongue, and some of you are probably familiar with tongue tie, or ankylosing is the medical term for that. So we have, once again, we want to get a good mouthful of breast, and we want that tongue extended over baby's, we want the baby's tongue extended over the lower gum line. So baby uses his or her tongue to massage the breast tissue. So if that tongue is retracted, or baby can't extend the tongue for any reason, then now we have hard gum line here. And that's where baby will tend to slide down and will be more nipple feeding, more pain for the mother, less ability to transfer milk, and mom will feel that biting or pinching sensation. So we always want to try to help mom identify how it feels and tell us, does it feel like tugging or pulling, but not any biting or pinching sensations. That we'd want to look into and see what we need to change. And sometimes just doing a position change can maybe help baby stick that tongue out. But we may need someone to do an oral assessment and evaluate if we have something going on with the tongue that needs to be addressed. And that may mean the physician needs to come evaluate, or we need to make sure mom and baby get a checkup with someone immediately post-discharge to evaluate that. So tongue extension is really important. Now another aspect of a good latch is if baby has, once again, a deep latch, a good mouthful of breast, you shouldn't hear any clicking or kinds of sounds. So take a second and think, how do you make a clicking sound in your mouth? What do you have to use to make a clicking sound? Is that my tongue? So what does that tell you if you hear a clicking sound when baby is latched on? That means we have our tongue retracted. So that's something to listen for. And then we want to take baby off breast and relatch, change position, see what we need, and make sure baby can extend their tongue. The other thing you should be able to see is, let's grab my baby again. If we have a good mouthful of breast, then baby should have, my baby has cute little fat cheeks, right? You shouldn't see any cheeks being sucked in. So once again, you guys can do this while you're watching this. What do you have to do with your mouth to suck your cheeks in? How do I open my mouth? I can't have a wide open mouth and a mouthful of breast and have my cheeks sucked in. It's not physically possible. So that tells me that I have a very shallow latch and my mouth is pretty tight. So looking at the angle of the mouth, if you see a wide angle to the lips and you see the cheeks puffed out, those are all initial good signs when you're evaluating a position and latch. And then once again, always asking the mother, what is she feeling? She, tugging, not pulling, tugging and pulling, not biting or pinching. And